Hey everyone, I am Hillary. For those of you who don't know me, I'm at my office at Core Physical Therapy in Washington, D.C. right now. Today we're going to talk about neutral spine and why it's important. So I have a lot of patients who have a lot of low back pain, and we talk a lot about neutral spine. Even once I teach them what neutral spine is, they tend to have a difficult time finding it and maintaining it and staying strong in that position. So a quick little review. Here is a spine. We have three normal curves of our spine. So the cervical spine goes inward. If you feel the back of your neck, it goes inward, which is called lordosis. Then the mid-back is called your thoracic spine, and that goes outward, which is called kyphosis. And then your low back goes inward, which is called lordosis. So that is your normal neutral curves of the spine. The more that we can maintain those neutral curves, the better off we're going to be as far as less pain, proper posture, moving more efficiently. And so when we are in neutral spine, there's less pressure on our disc, and our pelvis and our lumbar spine and everything else just works so much better. When most people, when they're slouching and they're sitting, they go into something called a posterior pelvic tilt, where they tuck their butt underneath them, and they're sometimes even sitting on their sacrum, and their back is totally flat, which ends up putting a lot of compressive force on that disc. And that's where you end up with sciatic symptoms and low back pain. So as much as you can maintain that neutral spine, it's what's really important. And so as far as finding neutral spine, the best way to do it is when you're lying down on your back. So I'm going to go ahead and do that. So you want your knees bent, and then I usually say, if you can, these bones here are called your ASIS, anterior superior iliac spine, ASIS, and then you have your pubic bone there. So you want your ASIS and your pubic bone in the same plane of motion. I can show you what that is in standing too. So when I'm just lying here with my knees bent, most people are in neutral spine, which means that there's a little bit of a curve in your low back, so that it's not arched and it's not flat. So this is a posterior pelvic tilt, and this is an anterior pelvic tilt. And so halfway between those two is usually called neutral spine. So what you could do is, this is called a pelvic tilt exercise. So go into a posterior pelvic tilt, flattening your back. Now go into an anterior pelvic tilt where your back is really arched, and then come halfway between that, or just kind of relax into that position, and that is neutral spine. And then I usually try to train people as far as strengthening in that position using those lower core muscles, which is called the transversus abdominal muscle. And so engaging that transverse abdominal muscle is really what Pilates is all about, is what core stability is all about, trying to get strong in that neutral spine. So when we do planks and side planks and bird dogs and all sorts of exercises, those are really good exercises to get you strong in that neutral spine. When we're doing crunches and sit-ups, that is not neutral spine, that's a posterior pelvic tilt or lumbar flexion. That is also okay to do. It's not like you have to stay in neutral spine all the time. Depending on what you're doing, your body should be able to move in and out of those positions, but you want to be able to be strong in neutral spine too. So lots of times people will be walking around with their butt tucked underneath them. I'm hoping that I'm still in the camera. With their butt tucked underneath them, which is called a posterior pelvic tilt, and you don't want to be there. You want neutral spine. You don't want an anterior tilt either, so you somewhere in between that is a good neutral spine. Anyway, so those are my tips on neutral spine. If you have more specific questions, I'm happy to hop on a phone call, or you can set up a telehealth appointment with me at Core Physical Therapy. So contact me if you have any questions, and have a great day, everyone.